Howdy, I'm Haley, and I'll be focusing my Unit 6 presentation on the development of eating disorders, their prevalence in relation to the human body and mind, and the short-term and long-term consequences that individuals can face. Eating disorders are conditions that are caused by a range of factors characterized by extreme behaviors, emotions, and attitudes towards food, weight, and body satisfaction. The disorder is not about the food and rather the underlying thoughts and feelings that the individual can display through the disorder. They're very complex and can cause very significant negative impacts to an individual's well-being. Intervention and prevention are vital to the recovery of individuals who suffer from an eating disorder, and without that recovery, consequences can ultimately be detrimental for an individual. The three main eating disorders that I will be speaking on today are anorexia, bulimia, and binge eating disorder. Anorexia is characterized by an intense fear of gaining weight and a manifestation of compulsive weight loss behaviors. For individuals who struggle with anorexia, they operate on a key goal of becoming thin and have tendencies of distorted thinking in their body image and body size. Behaviors that are aligned with anorexia include inadequate food intake, preoccupation with their dieting and calories, restrictions and refusal of food, social withdrawal, distorted views of their self, and then extreme exercise. Bulimia is also referenced as binge purge syndrome, and it is characterized by repeated episodes of uncontrolled eating that is followed by repeated performance of compensatory behavior, such as throwing up. The binges can be preceded by feelings of tension, and the behavior followed compensates for and undoes the effects of the binges. Behaviors aligned with bulimia include frequent episodes of large food consumption, use of preventative weight gain measures, frequent bathroom trips, rigid routines, and social withdrawal. You can see that anorexia and bulimia consist of similar system clusters, which would be abnormal eating, the fear of gaining weight, and body shape distortion as well. And while they all do have the same system clusters, they are manifested and characterized through different behavior. Binge eating is characterized by excessive food consumption, typically followed by guilt-related emotions, and the rapid food consumption is not a compulsion to overeat, and rather it exhibits expression of underlying issues. Eating disorders can impact anyone. However, there is a much higher prevalence of females being diagnosed for anorexia or bulimia than there are males, and that difference is still prevalent in binge eating disorder. It is just not as drastic. And then eating disorders do typically present themselves in early to late adolescence, and then you do see that binge eating disorder once again is a little bit of an outlier, and you see that it kind of displays itself in early adulthood. The explanation of the causes of eating disorders is most commonly assessed through a multidimensional risk perspective, which can assess a variety of factors for an individual that can be at risk for the development of an eating disorder. This can be inclusive of societal and multicultural factors, psychodynamic and interpersonal factors, and then behavioral, cognitive, and biological factors as well. And the interactions between these factors, along with a combination of eating disorders paired with other psychological diagnoses, can amplify symptoms and result in a longer or a rougher recovery. Comorbidities are the psychiatric and medical conditions that coexist with other diagnoses, and eating disorders specifically have significantly high co-occurrences with psychiatric or psychological conditions and medical conditions as well. And this can be referenced through a meta-analysis study that was done in 2022. And these comorbidities allow for bidirectional consequences to persist, but the management of both medical and psychiatric comorbidities could definitely improve treatment response and outcomes in individuals with eating disorders. For adolescents with predisposing vulnerabilities, triggers that come with puberty, such as new stressful life changes, bodily and growth changes, mental illnesses, and then possibly substance misuse, this can all and more can prompt the onset of an eating disorder. And then furthermore, the individuals that tend to have a lower self-esteem or have higher levels of body dissatisfaction can be at a higher risk. And then changes to the body, such as an increase in physical activity or a change in one's dieting, can definitely promote eating disorder behavior as well. From more of an environmental perspective, parental influences and peer pressure can definitely relate to the onset and the persistence of an individual's eating disorder. And then from a biological perspective, in anorexia, there have been twin studies that suggest high genetic components associated with the disorder. And then with anorexia and bulimia, there are similar brain abnormalities seen in brain imaging to other psychological disorders or conditions such as depression. For adolescents with predisposing vulnerabilities, triggers that come with puberty, such as new stressful life changes, bodily and growth changes, mental illnesses, and then possibly substance misuse, this can all and more can prompt. An eating disorder can impact every aspect of an individual's life, and complications can range from being benign and self limiting to being potentially life threatening. Substantial physical health and mental health issues and conditions can arise in correspondence to the individual's experience of their eating disorder, especially for those who are at higher risk. And health consequences are inclusive of cardiovascular, gastrointestinal, endocrine, psychiatric, and neurobiological systematic altercations. Eating disorders seem to persist in age ranges that are a critical period of development for the brain, allowing for unwanted altercations and thus exacerbating the cycle of an individual's eating disorder. These conditions can cause for both reversible and irreversible effects of the brain and the body. Individuals with anorexia ultimately deny their body the nutrients it needs to properly function, which results in nutritional deficiencies and, for females, menstrual irregularities. Some cases will result in amenorrhea, which is the loss of an individual's period. And then, as the prevalence of the disorder continues on, irregular hormone functions, electrolyte imbalances, malnutrition issues, and then decreased bone mass density complications can arise and persist in individuals, and this can potentially occur for the rest of their life, especially if treatment or recovery is never set in place. Individuals with bulimia experience recurrent binge and purge cycles that can ultimately impact the entire digestive system, and then that can also lead to dental issues. Menstrual irregularities are also present in bulimia for females, but it's not to the extent that you see in anorexia. And then binge eating disorder can lead to obesity and prompts tension in one's daily life. These eating disorders can all lead to increased psychiatric risks as long as physical or medical risk, and they have high prevalence rates to conditions such as anxiety disorders, depressions, or OCD, which is obsessive compulsive disorder, and then substance abuse as well. And these problems can persist even with treatment of an eating disorder or not, and it can be a very long and difficult process for the individual. The most common and effective therapy for eating disorders is cognitive behavioral therapy, which can consist of individualized group and family therapy that is utilized for patients in rehabilitation programs and is beneficial to the support that an individual needs throughout their treatment. The earlier that an eating disorder can be identified, the higher the chance of full recovery for that individual is, as long as the duration of their recovery being shorter. For individuals with anorexia, sometimes in some cases, restoration of weight and nutritional gains is essential to recovery. So they'll need to be put on a nutritional rehabilitation plan or in some type of program. Drug therapy is not efficient for the intervention of anorexia, but it can be used for bulimia and sometimes binge eating disorder as well, although it's specifically beneficial to bulimia. With a variety of factors at play in eating disorders, there's a lack of accuracy in pinpointing why higher rates of eating disorders are being observed. As more research is conducted, increased comprehension of eating disorders can allow for more beneficial application of programs and practices for the prevention and intervention of eating disorders. Current goals in research regarding eating disorders involve development of programs that prevent the onset of eating disorders and promote awareness. Relapse can occur with any eating disorder through stressors or triggers in life that can have those lasting psychological and physical impacts. With eating disorders among adolescents being more severe now than ever, it is essential for us to understand what needs to be considered to produce an effective decline of eating disorders. Further understanding of eating disorders could be examined through their interactions with other simultaneously present conditions, which brings me to my discussion question on how the identification of eating disorder comorbidities in an individual can provide further insight into the development and the nature of eating disorders. Thank you guys for listening to my presentation, and I look forward to looking at y'all's answers.